My name is Piyush Poddar, and I'm a rheumatologist by profession. I completed my medical school in India and then came for higher studies in United States, and I did my residency from Cleveland Clinic and then fellowship in rheumatology at Cleveland Clinic. Then I was working as a chair of rheumatology in Bismarck, North Dakota for nearly 8.5 years, and then I decided to move to Iowa. I chose medicine because I think the most important thing for me is to be able to help out others, and I think that gives me the most gratification. Rheumatology is a very interesting and a complicated and a challenging field. It's a lot like a detective work where we have to listen the story of the patient, we have to examine them, we have to take into account their labs, imaging studies, and we have to put everything in account, and then only we can come to a diagnosis rather than just one lab telling us the disease diagnosis. And it's a comparatively newer field in the sense of newer medications, exciting medications coming out. So now we can help our patients much more in a much more effective and meaningful way. Also, rheumatology is more a long-term relationship with patients because we deal usually with chronic diseases. Developing a long-term relationship with patients, which I love about it. I think the most important thing for me to practice medicine is to make sure that I can help the patient and can give them the best care possible. I try to be scientific, evidence-based about it, but in the same time, I also try to make sure that I understand what are the needs of the patient and where are they coming from. In that way, I can help them better. I strongly believe in doctor-patient partnership so that we know what they want, what they're looking for, but also I think with expectations comes some responsibility which doctors have to share and the patients have to share about their disease and health management. I chose Great River Health because when I came here to interview, I found the people here very nice, cordial, inviting. I had a great experience with the whole interview process, including a great recruiting team. Choosing Iowa was because I have friends and family around, so this will be closer to people I like to spend time with. And also, it's a great place because there are so many access points for traveling in all the directions. When I'm not doing or thinking about patient care, then I usually read, and I like traveling, spending time with my family, and then I play a game called cricket, which is very famous in India, a little bit akin to baseball.